Hi everyone, this is Dr. Stefan. Welcome to another video, and this one about the relationship between smoking and lung disease or COPD. And I got a comment that I think, just challenges some of the recent videos that I've made around the fact that, if someone has COPD, one of the advice that we give as doctors is that people try to stop smoking because there is extensive evidence that smoking is bad for the lungs. And I think that's beyond question now. But it's just... sometimes I think people do not want to accept that. And I'm not trying to respond to the comment in a bad way. I'm just trying to be realistic. I mean, we all have our biases. We all have our ways of looking at things. There can be, from my own experiences, I know that you can have people who look at the same fact. Two different people will have two different opinions of the same fact, even though the reality is maybe just one. Everyone has their own perspective. It's kind of how we end up in trouble sometimes. But look, I'm not challenging, but I just wanted to read this comment because I think it's interesting. So basically, the person who was wondering about the smoking, I made a video about how to stop COPD from worsening. One of the pieces of advice there was that potentially if you are smoking, to try to give it up. And I know it's hard. I'm not saying that it's easy, but it is one of the most important things that you can do to stop COPD from progressing. But let me read the comment. So the comment goes as such. I've recently discovered that many people who have traffic accidents are or have been smokers. Does this mean that smoking causes traffic accidents? So yeah, this is again, correlation is not causation. Okay, we can discuss about that. And then basically the person who commented then goes on to challenge what I've said, saying that the medications you speak of only mask the symptoms and do nothing to treat the cause. If you blindly blame smoking, you will never find the true cause. Well, look, I mean, the medications that we have for treating COPD also are introduced when the damage is already done. So, I mean, at that stage, we may not be able to reverse the problem that is already in the lungs. So if someone, for instance, has severe emphysema, they have significant airways disease, and the medications that we use through inhalers, for instance, try to keep the airways open, you can imagine that that person, yes, will have less symptoms. The symptoms are masked, but the symptom is breathlessness. The symptom in this case is breathlessness that does not allow that person to do much in their life. In some instances, it can be really, really severe. So if you can imagine, if someone's struggling to do their job, they're struggling to dress, they're struggling to make their bed, to do activities around the house, to clean their house, if they're using an inhaler and that allows them, that gives them some part of their life back, I mean, in my mind, that doesn't mean that it's the wrong treatment and we shouldn't use that medication. And then even if we don't know the true cause in that situation, we still need to do something. We cannot just ignore those symptoms. And in many conditions in medicine, that's true. We are treating the effect of something that's happened in the past. We cannot always reverse damage that's been done. And I just want to be realistic about this. And I know some people may feel that, okay, I'm pushing medications onto people. I'm not. I'm actually one of the many doctors that actually don't push medication onto people. I'd rather that you have minimal medication. But in some instances, I cannot deny the fact that people do need something. And a lot of people who come to clinics actually expect some treatment to be given. It's very difficult to explain to patients, and I can tell you this from a practical point of view. If someone comes to my consultation and I just have a chat with them, and at the end I'm saying to them, look, I don't think you need any treatment, a lot of people will find that hard to understand because they have come to that clinic because of symptoms that they want relief from. So if someone, for instance, has a breathing difficulty, they have COPD, they are really, really struggling, and I prescribe an inhaler upon a discussion with them explaining what that inhaler might do, and that inhaler helps them live better, I think that's a good treatment. This is my opinion. I mean, you don't have to agree with me. I'm not saying that, and I'm not necessarily trying to challenge what this person is saying in the comment, but I think we need to look beyond the fact that, oh, we haven't found the cause. In many things in life, we haven't found the cause. We don't know why we are on planet Earth. We don't know how the universe was formed. Sometimes, we don't have all the answers, but we're trying to live the life that we have been given, and we can be grateful for it and live it in the best way we can. And if science has brought us some medications that give us relief and allow people to have better lives, I think there's a good argument for using them. Now, with regards to the smoking, there is ample evidence that it causes lung cancer, COPD, cardiovascular disease, all kinds of things that are bad for us. So obviously, in many cases, and I've said this many times on the channel, people don't have much of a choice when they do start smoking, but they have a choice of quitting later. And I'm saying that people don't have a choice when they start smoking is because they sometimes grow up with surrounded by people who smoke. Maybe people in the family are smoking, family, friends, peer pressure, all these things when we are just forming our personalities as we are growing up, when we are, 12 years old and we see everyone smoking, the cool kids who are older than us are smoking. Of course, that will shape our choices and we will end up growing with the smoking. And it will be extremely hard to give that up when we are 60 and we're starting to see the effects of those 40, 50 years of smoking. It's really hard to give it up because it's almost part of our personality. And we all know people, I certainly know a few friends who, if they didn't have a cigarette in their hand, they wouldn't be themselves. But that is a wider philosophical question of whether that is actually our true self, the person with the cigarette who talks about interesting things about philosophy and so on. Could we maybe do that in a different way that's healthier? Could we find an alternative way? Could we maybe switch to nicotine replacement therapy, which is basically maybe lozenges or, chewing gum or plasters or things that don't give us the smoke inside the lungs, we're not delivering that nicotine in such a harmful way? Could we think about risk reduction? All of these things, I think, are all good questions. And yes, of course, I think the first part of the question, when they're saying that, recently discovered that many people who have traffic accidents are or have been smokers, does this mean that smoking causes traffic accidents? So, of course, that's a perfect example of, correlation is not causation. We can find a scientific association between two completely unrelated, implausible things, and say that there is a connection. And sometimes scientific data is fudged that way. I admit that that is something that can happen. But in this situation, there's been an abundance of evidence that people who smoke have worse health outcomes. And that's not something that we can deny. So we are not blindly blaming smoking, as the person who has commented said. We're just saying that as doctors and as many healthcare providers will say, and I think the vast majority of the population now understands that smoking is not good for you. It's just we're not blindly blaming the smoking, and we're not blaming the smoker. Again, this is very important. I'm not blaming the smoker. I never have. I never blamed anyone. Okay, why are you smoking? I've never had that attitude in my clinics, in my clinical practice. I've never had that attitude with patients. But I have the responsibility to give you that piece of advice and to say that, look, I think in your situation, smoking is bad for you. I think that's fair for me to say because I've seen the effects of smoking and I've seen how much damage it can do to people's lives. So I'm not blaming the person who's smoking. I'm not blindly blaming the smoking. I'm just saying that there is a connection. And for many people, especially who have already developed lung disease, who are already maybe diagnosed with asthma, they're on a bunch of inhalers, or maybe they have severe COPD, they're smoking and they cannot have oxygen at home because there's a fire risk because of their smoking at home and other things like that. So there are some situations in which actually making that recommendation to stop smoking is so beneficial. And there are support services these days that are really effective at helping people get off the cigarettes. And as I was saying before, if someone has grown up with smoking for 40 years, stopping is going to be the most difficult thing that they've ever done because it's simply like ripping a part of their personality out and replacing it with something else. And some people do not always find the right coping strategy with this. Some people end up putting a lot of weight when they stop smoking because they need to replace that pleasure that they've had from the cigarettes with maybe the pleasure of eating good food, or maybe that appetite suppression is gone that we get with the nicotine, or maybe there is another toxic trait that emerges when we remove the smoking. Maybe we're a bit more aggressive, more jumpy. So it's important to notice our reality, notice how we're reacting to things with and without the cigarettes, and try to make a gentle shift towards maybe not smoking, maybe healthier habits, maybe taking up community engagement, social events, sports, exercise, singing, music, theater, whatever, arts, whatever is better for our health than just smoking. There are alternatives. That's all I'm trying to say. I'm not blaming anything blindly, and I'm not necessarily defending what I've said before. I'm just trying to explain my rationale. And I hope this is helpful for some of you. I think it would be better, the world would be a better place if there were less people smoking, but we still have a very, very long way. And some of it is actually just trying to tackle this mentality that, well, you know, we don't have enough evidence, we don't have this and that. You know, sometimes there is an example of a person who has smoked for many, many years, they were fine, and that kind of like is the example that sort of everyone relates to. But actually, the likelihood of causing damage with smoking is much higher than the likelihood of being well and smoking. Anyway, this is a perspective. Feel free to disagree. This is the point of humanity. We can all disagree sometimes, but I think it's just important to try and think what's the best choice for you. All the best and good health.